Myth 1, their magic hands can find the problem. They can't tell where there's pain or a problem just by touching you. If it seems like they've detected it, it's usually because you squirm and give it away when they hit a sore spot. The reason they can't tell is because how the tissue feels doesn't have much to do with pain. Really hard and tight tissues can be pain-free, and really soft tissues can hurt a lot.
This is a chiropractor that I really respect. He's very science-based chiropractic, gives a lot of great information out on his TikTok. If you haven't seen his videos, go check him out. But I wanted to address the ones he's talking, since we're talking about the massage industry. I've been doing this for 14 years. Massage therapists can't find stuff. In general, this is true, right? Like when I'm working on a client, I can't tell if this tightness that I'm feeling or this density in the tissue that I'm feeling is actually painful. So when clients, they always ask me, how did you know that was there, right? It's like they think I'm like a magician or something. I can't tell if it's hurt, painful, or tender in this area. What I feel is, the way I describe it, is like a density in the tissue. There's almost a change in the tissue is what it feels like, or this ropiness that I feel. I don't know how to explain it, but it's basically an educated guess, right? Time and time again, after I've been doing this for a while, first off, there are super common areas that people experience this tightness in their tissue. And when I push there, 9 times out of 10, there is some sort of tenderness there that is either referring pain up into their head or something like that. I can feel something here, right? There's a density, there's something that is drawing me to this area. And whether it can be proved by science or not, I get it right a lot of the time. As far as the claim that we can't necessarily feel where there's pain and tenderness, that's true. As far as the claim that says, where he says, if it seems like we detected the spot, it's because you squirmed, also true. Yes, I mean, your movement, your changes in breath, a twitch in the muscle are all things that we look at as massage therapists to determine whether or not we are on a good spot or a bad spot, in your case, something that is tender, tight to you. I don't see how this is an issue. We use the tools. Palpation is just one of the tools, right? We also look for changes in breath, again, twitching in the muscle tissue. Did you squirm, or are you trying to get away? Are you tensing up? Are you guarding? Things like that. We look for all that stuff to determine whether or not the area that we are on is a problem. I don't see how that's an issue, right? The thing is, and this is where most massage therapists mess up though, is I don't just leave it to what I feel in the tissue, because as he stated, sometimes there is no pain there, or sometimes that area isn't the area that is contributing to the problem you came to see me for, right? And this is where massage therapists really screw up, because they actually do think that they know what's going on, when they don't. At best, it is an educated guess. So you have to open up communication with your client. And I always ask them, and especially, let's take the upper back, for example. If there's a lot of tightness in the upper back, I need the client to communicate to me which one feels like it is contributing to the problem that you're having. The other ones we can focus on later, but I want to make sure that I'm as effective as I can be in this session, and communication is how we get there, not me just playing a guessing game. Because if I do that, I get it wrong all the time. Any massage therapist that tells you that they know exactly where you're hurting, they get it wrong constantly.